Awesome. Yeah, so this is my APS talk from this year. So we called it Sociophysics of Subjective Pain, Robust Cluster Assignment. That kind of three-word phrase is what I've been spending more time thinking about recently, based on sparsely and irregularly sampled data. And actually, Eric, I'm glad that you're logged in here. I'm been curious to kind of talk to you about what I've been doing and see how closely it aligns with what you've been up to as well. So
yeah, I'm excited to learn about it.
Awesome. So our focus has been pain in sickle cell disease. So sickle cell disease is a genetic blood disorder where red blood cells are misshapen into sickle-shaped cells. And it is, the primary symptom associated with sickle cell disease is pain, also anemia and several other symptoms, but the primary one is pain. The main way that pain happens is through vaso-occlusive events, where a blood vessel in the body gets blocked by these misshapen, I think they're also hard blood cells. And these kind of acute pain events occur for more than half of patients have one hospitalization a year from these acute pain events. And many patients suffer from chronic pain, where they are experiencing some amount of pain on more days than not over a period of about 6 months. The data that I've been playing with to better understand this comes from a app. Here's a picture of the app from a previous study that looked at this data. Sarah Clifton, who graduated from the department a while back. This app allowed patients to interact with their doctors and report their pain over time, report their pain level on a scale of 0 to 10, and also if they took medication, opioids, non-opioids, kind of used some non-medication activities to manage the pain. And the benefits of this data set is that we get some really long-term longitudinal data. On average, it's 165 days per patient. We have a couple that only used it for a month or two and a couple that used it for almost a year. So that's fantastic. The challenge is that this data is sparsely sampled. So this isn't really sampling methods. This is just dealing with data that is sparsely and irregularly reported. So on average, people reported 0.4 times a day, every other day or so. The time scale on this axis in the top right is 14 days. And so we have one example where this person reported 4 times, and at the top, somebody reported, I haven't counted, close to 15 times. And so the question becomes, how do we define, so the need, we need methods to compare, and I've been interested in clustering to get at the different ways that people experience pain. So we need methods to compare and cluster this sparsely sampled data. So we also generated some synthetic data so that we had a good sense for a good answer.
So I have a question.
Yeah,
is this self-reported data?
This is all self-reported. Yep, self-reported scale of 0 to 10, which is really messy. You know, what I say is a pain level of 3, you might say is a pain level of 1. Somebody else might say is a pain level of 5. But it's also the best way that we have to know how much pain somebody is in, is to just ask them. So it's very messy, but it is the best way that we have to measure pain.
And what are the difference between the colors in
the colors in these plots are just colored according to the mean of the trajectory, just to give some way to distinguish between them. So you can see at the bottom group, I gave them a constant mean and then gave them a random number of time steps and allowed them to just have a standard deviation of 1 around that, so that we have 3 nice groups because they have pretty consistent means. And of course, in real data, there's not clear kind of means. And the synthetic data gives us ground truth for comparison with real data. And so then step 1, we have kind of an archive preprint about this. We submitted it as a conference paper. It wasn't a good fit for that conference, so I'm not sure exactly what to do with this piece of it. Was to compare different ways of aligning the data. So you can interpolate using nearest neighbor or linear interpolation. The advantage to that is that you can treat it as a time series, which is really nice. But the disadvantage is that you're assuming a lot about what's happening. And this particular example, I think this is a real data set that I pulled. This person only reported 4 times over 14 days. So we're assuming a lot about what's happening in between their reporting of pain levels. Alternatively, you can look at just a histogram of the data, which is the advantage is we're not making any assumptions about what's happening in between data points, but the disadvantage is that you lose time information. And so kind of the first thing that I did on this project was to compare these different approaches and use them for clustering and see how well they worked. We use spectral clustering, where you construct a network based on similarities between trajectories. So here's my little schematic over here. If we have 5 samples, 3 of them are very similar, 0.8, 0.9, 0.7, and then 2 of them are very similar, 0.9 at the bottom. And then there's like a 0.1 and a 0.2. So you can kind of weight the edges between the nodes in your network based on a similarity, which I'm just using like a normalized inverse of distance to generate a similarity. And then you construct the graph Laplacian, which is the degree minus the adjacency. And then you can cluster the eigenvectors of L effectively. And the advantage of using the spectral clustering is that it works really well for irregularly shaped groups. A lot of classical clustering methods don't work particularly well when the groups are non-convex. So then we can use this, we can look at, hey, it seems to work well for 3 groups, and we can compare the 3 groups. So low pain, medium pain, and high pain. And we get kind of the nice takeaway. Did I give a, yeah, we get a nice takeaway that maybe there are 2 types of chronic pain, people with kind of this really severe persistent chronic pain, and people that usually have pain on more days than not, but it's generally more manageable. This class 2, the mean is somewhere around 4, and it's also highly varying. And that also matches up, we're in collaboration with a physician who works on this, that matches up with his observations as well. So that's a nice story. The way that I structured this is, here's a nice simple story, but how many clusters is the right number of clusters? Tried some cluster validity indices and some information criteria, but we kind of want to get at that question a little bit, and how robust is our approach to variations in the data. And so we introduced a thing we're calling bootstrapped cluster robustness. This is the thing I'm still trying to wrap my head around and write up. So what we do is we bootstrap the data. So we repeatedly resample with replacement. And here each sample is a trajectory. So I don't remember how many 2-week trajectories in my data set. It's something like 200. So then I randomly draw 200 trajectories from my data set over and over again. And for each pair of trajectories, you calculate the frequency that they are clustered together. So you resample all your data, you cluster it into groups, and then you see, are these 2 trajectories usually in the same group? Are they usually not in the same group? And then you cluster rows of this co-occurrence matrix C into K groups and compare that with an ideal matrix A. So this is an example of some clearly 3 cluster data based on this co-occurrence matrix. But if we force it into 2 groups and do it over and over again, then I guess my color map goes from dark purple is 0, yellow is 1. So a 1 means they're always in the same group. Dark purple is they're never in the same group. And then the green shades show that maybe half the time these 2 trajectories are in the same group. And so we compare that with the ideal matrix, which is that these are clearly, obviously clusters that are well separated, and trajectories that are within the same group are always together, and in different groups are never together. And then we come up with this kind of mean co-occurrence error. So we take the kind of norm of the difference between our ideal matrix and our co-occurrence matrix. And then we come up with a maximum error, which is dependent on the number of clusters K. And then if we normalize by that maximum error, then we get this robustness term, R. And so this is what that looks like for our synthetic data, synthetic pain data. So this is 3 nicely organized groups. You see that well in the second plot there. But if we force it into 2, 3, 4, 5, or 6 groups, then there's some amount of error induced as we kind of resample this and look at how frequently these points occur in the same group. And so the error is 0 for 3 groups, which is great. That's what we want. And then you can look at how that error varies for the number of clusters. And the robustness is at a maximum for 3 groups, and you can look at how that error varies. And then the real data, the error is at a minimum at 2, and it is most robust at 2. It's also fairly robust at 3. So maybe it makes sense to consider 2 groups. Maybe it makes sense to consider 3. 4, 5, and 6, your robustness starts to tail off more and more. So yeah, we perform unsupervised machine learning to place patient pain experiences into groups. We introduce this bootstrapped cluster robustness to quantify clustering consistency, and it may be reasonable to consider either 2 or 3 groups of patient experiences with pain. And so there's some next steps and our little archive paper too. So I think that's what I've got to say today.
Thank you for the talk.
Yeah.
I wanted to ask, can you explain a little bit more about how do you create the network and what the eigenvalues mean with respect to the clustering?
That's a good question. Yeah. So the way that I construct the network is to calculate a distance between, in this case, we're comparing trajectories. So you calculate a distance between trajectories. We've tried different ways of doing that. Yeah, for now, just consider like a 2 norm. With the histogram, you have to use a 1 norm of the cumulative distribution function, kind of the integrated distance between them. But you come up with some distance between trajectories. And then I do kind of like the maximum distance of the whole set minus that distance divided by that maximum distance, right? So then,
but for 2 different people, the pain is measured at different times. So how do you get the error?
Yeah, so you have to align it first to either, so you linearly interpolate is one way, or nearest neighbor interpolation. So then you put all the times on the same axes or the same time indices, or you use a histogram. And I've kind of used all of these and a few other approaches too. Or you use a histogram where you can directly compare the cumulative distribution functions. And it's something like KL divergence, but rather than the maximum distance, it's the integrated distance between them. And yeah, so you come up with that distance, and then max distance minus distance divided by max distance gives you 0 if the distance is 0, or no, gives you 1 if the distance is 0, and it gives you 0 if the distance is the max distance. So yeah, it's just a similarity is kind of, as far as I've considered it, is inverse of distance algebraically. And then, yeah, so you come up with that distance or that similarity. The similarity is the weight of the network. And what are the eigenvalues? What do the eigenvectors mean? That is a good question. That is all internal to the algorithm, so I've not thought deeply enough about that. I think it means, yeah, that's a good question. If somebody has thoughts on what the eigenvectors of the graph Laplacian are, feel free to share them. I don't have a good answer. Network theory is not my main area of expertise.
There should be one zero eigenvalue if it's a connected graph.
Okay.
And the second smallest eigenvalue tells you the rate of a graph, or like how fast information propagates.
Okay.
But
these are the eigenvectors rather than the eigenvalues. So we're transforming the matrix.
So the yellow stuff is the eigenvectors.
So the points here, this is just like this is a scatter plot of points that we have clustered using spectral clustering.
Oh, okay.
So this isn't showing either the eigenvectors or the eigenvalues. But what you do is you generate the eigenvectors, you have the eigenvector matrix, and then you cluster in eigenvector space. And it has the kind of nice property that things that are non-convex in real space become convex in eigenvector space generally. I don't know if there are promises of that. I can share a paper with you if you're interested.
How do the eigenvectors map to the real points?
So each point is a row in this graph Laplacian, and so each row of the eigenvector space. I haven't worked out the details of that. This is just me presenting, giving a high-level overview of an algorithm that I well understand. So happy to share that. The von Luxburg is it's like a tutorial paper of spectral clustering.
Can you show the next slide too?
Yeah.
The slide after this. Yeah, this one.
This one. Yeah.
So every time you do resampling, do the clusters change?
Yes.
Okay.
Yes. And that's kind of the point, is that, like, I guess, how dependent is this on this particular set of data points being in there, versus like if one or two were left out, then yes, the clusters change. And then it kind of gives us this nice idea if in the idealized case, there's a row, you can kind of pick out a few rows that are pretty green in here that, yes, they belong in this group, but not as consistently as some that are just always in this group, and you get this idea, we like the word belongingness, of how well does this point belong, and it kind of gets at like a fuzzy clustering type idea of like something is kind of further to the periphery of the cluster versus closer to the core of the cluster, because in reality it's a distribution of real experiences, and what we're trying to figure out is, like, are there kind of core experiences that people are distributed around, or is it just one big distribution? Yeah. So.
Does anyone have any questions?
Eric, I know that you've been looking at kind of consistency of UMAP and things like that. How similar is this?
I was going to say, it'd be interesting to, like, right now you're kind of averaging all of these robustnesses.
Yeah.
And, like, looking at the distribution of them could be very
that's nice.
Interesting to look at.
Yeah.
And then maybe comparing that to your synthetic results or something like that.
Yeah.
Right?
That's nice. Yeah.
Because that's often where these things show up, is just the shape of the distribution, not like signal shows up there, not necessarily in the mean or whatever, right?
Yeah, that's a good point. That's a really good point. So the distribution of like belongingness, or like that, like if you average a row, for instance. Yeah.
Right. Yeah, because each sample basically gets a score, right?
Yeah. Yeah.
Yeah.
Nice. I like that idea a lot.
Yeah. Because that might help you like decide between, for example, like this 2 and 3 cluster case.
Yeah,
right?
exactly. It's like they're both over 90% consistent.
Right.
Like, yeah, if you can think about it as a percentage. I don't know if you can.
Yeah. Yeah.
They're both over 0.9.
Right.
2 is better than 3, but if you're a doctor, then maybe 3 groups is more informative to you than 2. 2 might just
right.
be
Yeah.
chronic or non-chronic. And so, yeah, looking at that, I like that distribution of belongingness. I like the word belongingness. I don't know if it's real or related to something.
When you're making up your own metrics, you get to call it whatever you want, right? So,
exactly. Yeah. How similar is this or different than what you've tried in the past?
I have only like come up to like looking at clustering stuff. So I mostly focus just on the quality of the embedding, but then there is another, like, so whether the graph that you're embedding is like real or not.
It's an important question that I still am not convinced of. You can consistently put it into groups, but does that mean it's a real thing? I don't know.
I mean, this seems pretty solid.
Yeah.
But no, there is another paper I've seen that did something similar to this, but I think they used some other wacky metric that also, like, I think they were basically doing it with like PCA and then doing some sort of statistical test on whether resampling changed that result or something like that.
Yeah.
So if you want, I can try and dig that up.
That'd be awesome. Yeah, that'd be great.